Thanks very much, Catherine. First of all, I just want to commend Deputy Connolly and her colleagues for bringing forward this motion, and I agree with a lot of the sentiment that's already been expressed around the importance of having it in public ownership and the fact that there will be no religious influence. But I do want to take the opportunity to specifically focus on the maternity situation in St Luke's Hospital, which is based in Kilkenny, but it covers both counties of Carlow and Kilkenny, and at the moment there has been no easing of restrictions regarding expectant mothers, whether it's for scans, whether it's for the labour or for the birth. And I think it's really important that you look at this situation directly, Minister, and ensure that this hospital and these women are not being left out. Everyone has made the point, how it's an important time. It's a very exciting time, but it's also a very nerve-wracking and can be a very scary time as well. And it's really important that you do have your partner there at your side, not just for the birth and the labour. I would think also for the scans, for lots of the scans, people reference the 20-week anomaly scan, but I also think some of the earlier scans, a lot of women end up finding out that they've had a miscarriage. There's no kind of indication that you go in, you have your scan, and you're told the very sad news that there's no heartbeat. And I mean, that's just devastating for people. So you need to ensure that somebody is there with you and they're not standing out in the car park or somewhere, and your whole world is falling apart. You need to ensure that that person is there. And I do think that, if these were issues that affected a group of men, I don't think we'd be standing here having this debate. I think the issue would already be resolved. And I was struck by the fact that, we had a very good, very well organised protest. A number of women organised it outside St Luke's Hospital a number of weeks ago. But I was struck by the fact that when you look at the people making the decisions, and with all due respect to yourself, Minister, it's all men, and I think it's really, really important that women's issues and women's health in particular is taken seriously. And I mean, we've had countless debates in this chamber in my time since 2016. There's been debates well before that as well in relation to women's health. We've had the cervical situation, we've had the situation with the vaginal mesh. There's been so many different debates, and there's so many things that don't even get on the radar. I mean, people may or may not have heard the recent discussions on the Joe Duffy programme around the menopause and the amount of women ringing in, that had no help, no assistance, no support, weren't given adequate information. Why is it always when it comes to issues that affect women, particularly their health, that there's no information? It's the same with endometriosis. There's very little information, there's very little help, there's very little support. There's women, being forced to go abroad. There's women who are suffering in pain and in agony for years, nearly being made to feel like they're going crazy because, no, this couldn't be happening, or it's something else. Or, I know somebody very, very well who actually was on the verge of having a gallbladder removed. And they decided to do a last-minute scan, this person in their gown, ready to go, and it wasn't gallbladder at all. It was decided, oh, it's endometriosis. I mean, that is actually ridiculous that we're discussing that level of lack of information, lack of medical. There's this shying away. There's, not facing it, not knowing how to deal with it. And it's not good enough. It's not good enough for all of the women in this country. But I specifically would like if you could look at the situation in St Luke's Hospital at the moment in Carlow and Kilkenny. An excellent hospital with excellent care, but at the moment it is really falling down, and it's failing women who are expecting babies, who are maybe struggling to get pregnant, who are dealing with early miscarriage or various situations that you come across. And then obviously for the labour and the birth, and then the aftermath for some level of visits. I think I heard that some places are doing like a 30-minute visit per day. That's not available at the moment in St Luke's, and I think that those need to be looked at. And I'm just appealing to you when I have the opportunity today to speak directly to you, Minister, that you would look into that situation in particular. Thanks, Catherine.